Dr. William Wiley here from Cleveland Eye Clinic. I'm going to talk to you about the new Cassini fully fledged diagnostic surgical suite. What Cassini Ambient is, it's going to become the new gold standard for preoperative diagnostics and surgical planning. The Cassini Ambient is a diagnostic tool that does a few things on the preoperative side for cataract surgery. Number one, it can do a surface dry eye assessment. Number two, it can get a corneal topography plus total corneal power to help that surgeon plan what is the best astigmatism management for that particular patient. What makes it unique is it's gathering information for the total cornea. So it's not just the anterior cornea, but it's the total corneal power, which is critical when determining which toric lens power you're going to place. So within the new diagnostic surgical suite from Cassini, one of the key pieces is the new surgical planner. The modern day cataract surgeon wants the ability to have surgical planning that can be done from anywhere through a secure cloud-based system. The Cassini system allows for that. It allows for all the information, the preoperative diagnostics, to be viewed from anywhere, and allows that surgeon to understand those diagnostics and pick a proper intraocular lens with a proper sphere power, cylinder power, and alignment to then guide that surgeon at a later date or later time to help assure they're getting the best possible outcome. I can help that surgeon pick the proper IOL, the proper astigmatism management based on that preoperative total corneal astigmatism. That information can be directed straight to a laser. For example, the Cassini laser can be guided by the Cassini. Other diagnostic or therapeutic devices like LensR Ally or Bionic system can be guided by that surgical planning, all originating from that original diagnostic image from Cassini. One great feature of the Cassini Surgical Suite is the intraoperative surgical guidance. It's important for surgeons if we can eliminate manual marking and have a reliance more on digital marking to assure we have the proper access. The Cassini system allows for iris registration that can account for cyclotorsion, that can assure that that lens is placed on the exact axis. This eliminates surgical error and assures you've got the proper treatment for that patient and that patient's eye. Personally, I've been a big fan of intraoperative guidance during cataract surgery for astigmatism management. Furthermore, that image can be injected or projected into any microscope, so it's microscope agnostic. Traditionally, I've used a lot of intraoperative aberrometry to help, number one, make the diagnosis of astigmatism, power, and axis, and then use that to guide me for that toric lens placement. I've seen firsthand direct head-to-head comparison looking at intraoperative aberrometry as compared to intraoperative guidance from Cassini, taking preoperative images and relaying that intraoperatively based on total corneal power. And I was reassured to see, number one, that both intraoperative aberrometry and preoperative total cornea were very much aligned and sort of agreed with each other to make me feel confident that if I only had to rely on preoperative information, I think that would be possible. I think that there could be two different ways of looking at it. You could have a belt and suspenders and have redundancy using preoperative and intraoperative, or surgeons may find that they can sort of become more efficient by just using preoperative diagnostics to guide that surgical treatment and potentially eliminating a time-consuming step for that particular case. I think for those surgeons, it will translate to a high return on investment by saving time and energy during an expensive portion of that surgeon's day. Is the most expensive time is that operating room space, and if you can help save time in the operating room, I think that does have a direct return on investment. So in summary, the new Cassini Guidance Suite allows for confidence in preoperative information and allows for efficiency as that information is translated to the operating room, either through femtosecond laser, direct link, or through a link to any microscope to assure you've got the proper lens placement on the proper axis that's directly correlated through iris registration for that particular eye. Thank you for listening.